It is exhausting trying to lose weight. How many of us feel chronically fatigued and can't get a good night's rest? I think most of us know and understand that sleep is really important for many aspects of our health and overall well-being. But did you know that it also impacts your weight? So to start, let's talk about hormones. The first one being ghrelin. So with poor sleep, ghrelin actually increases. And again, this is that hunger hormone that we've talked about before, but cortisol, the stress hormone, also increases with poor sleep. At the same time, leptin, that fullness hormone, decreases in addition to orexin and neuropeptide Y. So overall, the impact of this is increased hunger and appetite and fewer calories burned. But despite this, in North American society, we are actually getting less sleep over time. So in the 1960s, the average adult got about 8.5 hours of sleep per night. But by 2009, that had decreased to 6 hours and 40 minutes. And many scientists have looked into the impact of this sleep reduction on health. And one study called the Wisconsin Sleep Study actually showed that very small amount of sleep, which would be considered less than 5 hours a night, is associated with a 2 times the risk of obesity and 2.5 times the risk of developing diabetes. For adults who get between 5 to 6 hours a night, there is still a 57% increased risk of developing obesity in their lifetime. And for people who get less than 5.6 hours a night of sleep, their metabolic rate or their metabolism is decreased. But shockingly, a third of patients in North America actually sleep less than 6 hours a night. So what is the ideal amount of sleep per night? Well, the studies actually consistently show it's between 7 to 8 hours a night because, as it turns out, you can have too much of a good thing. So when you sleep longer than 9 to 10 hours a night, it also increases your risk of obesity, even when we account for or control for the same number of calories consumed and the same amount of exercise performed that day. So next, as opposed to how long you sleep, let's talk about when you sleep, which is what we consider your circadian rhythm. So we know that compared to people who work during the day, night shift workers have increased insulin, glucose, and triglyceride levels in their blood after they eat. But after they eat a meal, ghrelin, that hunger hormone, isn't suppressed as much, so they're still hungry even after they eat a meal. And leptin, the fullness hormone, is also reduced, so they're still hungry even if they had eaten the same amount of food when they work day shift. And also, interestingly enough, poor sleep impacts not only how much we eat, but the type of food that we eat. So dysregulated sleep can make us crave high-calorie foods, especially salty foods, sugary foods, fatty foods, in particular carbohydrates. And as a shift worker, I can definitely tell you I have never in my life craved a salad or fruit at 3 o'clock in the morning. All I want is chips, carbs, pizza, all those kind of snack foods that are very high in calories. In terms of sleep disorders, I'm not going to go into detail about all of them, but I will mention one, which is obstructive sleep apnea, or OSA. So what happens in OSA is the soft tissues in your upper airway, when you sleep, relax to the point that they basically block off the airflow from your mouth into your lungs. So you stop breathing, and this of course disrupts your sleep, but also it drops your oxygen levels in your blood, which puts stress on your heart and your lungs. And sleep apnea is the most common sleep-related breathing disorder. so I always screen every single one of my patients for it. Because even a 5 to 10% body weight loss can significantly reduce the symptoms of sleep apnea. And lastly, since so many of my patients struggle with falling asleep and staying asleep, understandably, they often ask me, should I be taking a medication to help me sleep? And the answer is that's a bit of a double-edged sword, because unfortunately, many of the medications that are prescribed to help people sleep actually cause weight gain. And these are really common medications such as amitriptyline, Seroquel, and even Benadryl. So I would recommend that if you're going to ask your physician for a medication to help with your sleep, make sure it's one that we refer to as weight neutral, or one that does not cause weight gain. So to wrap up, sleep is yet another aspect of your health that can impact your weight, but the good news is it's way easier to optimize than, say, changing your genetics, and you have a better chance at succeeding in your weight management journey with optimized sleep. So here's to a good night's sleep.